In 2023, about 47,000 Americans were killed by a firearm injury. Yet, we continue to talk about firearm injury as a partisan or political problem instead of as a public health problem. Why? What makes something a public health problem is the idea that it affects a community or a population. My relationship as a doctor with a patient, one-on-one. When I'm thinking on the public health side, I'm thinking about, on a population level, how can I change the systems or structures that either got that person sick or injured, or that keep them that way? So I think about firearm injury as being a health problem on a few different levels. First is obviously the physical level. If you get shot by a bullet, it causes physical damage and trauma. There's a second level, which is the psychological trauma to the person who is shot. We know that there are high rates of post-traumatic stress, anxiety, depression, and even substance use disorder. But the third level of firearm injury being a health concern is actually about the effect on people who are not ever touched. For example, after there's a shooting in a community, we see that kids do worse on school tests, and they are more likely to come to the emergency department for mental health crises, even if they didn't know the person who was shot. As a society, we don't talk about firearm injury as a public health problem for a couple of different reasons. First, from 1996 until 2020, there was this thing called the Dickey Amendment that was passed that explicitly took money away from the CDC that it had been spending on firearm injury prevention. So the first and biggest reason is because there was no money to research or act on firearm injury as a public health problem for 24 years. The second reason why I think we don't talk about firearm injury as a public health problem is honestly, I think it challenges people to think outside of their usual boxes. My guess is you've never thought of it as a health or public health problem. You've thought of it as a divide between give everyone a gun or take everyone's gun away. You can see how the public health approach doesn't fit into those neat boxes. In fact, sidesteps them altogether. When we talk about firearm injury as a health problem instead of as a criminal justice or political problem, it creates a whole set of different types of interventions that go far beyond just legislation or policing. One is community violence intervention programs, particularly in urban areas, but also sometimes rural areas. A second intervention that shows great promise is around firearm suicide prevention. And then a third example is programming to allow community members to identify and then act on risk. My hope is twofold. First, that we can overcome the divides between communities that keep us from talking honestly about the health problem of firearm injury and its ripple effects. Second, and more importantly, I hope we figure out how to stop those ripple effects, both by providing solutions for the many, many Americans who have already been affected, and more importantly, to stop future children, adults, and families from having to confront this American epidemic.